name is Amrita. I'll be examining your nose, mouth and neck today. What is your name?
Shahabuddin Sarkar.
Okay, let's start with your examination.
Okay.
We begin with inspecting the anterior and inferior surface of the nose. We note any asymmetry and deformity. We test the obstruction by pressing each ala of the nasal and asking the patient to breathe in. Then we tilt the head of the patient and with the help of the light we observe each nasal vestibules and the nasal mucosa carefully. We conclude our nasal examination by palpating the sinus tenderness. First, we palpate the maxillary sinus and then the frontal sinus.
I would like you to wipe your mouth with the tissue. Okay.
At first, we examine the outer surface of the lips for the symmetry, moisture, or any lumps or ulcer present.
Open your mouth.
Now, wearing our gloves, we inspect the inner surface of the lips, the gingiva, and inspect the teeth. We also note the color of the gum. We inspect the color and texture of the hard palate and note the movement of uvula as the patient says, "Ah."
Lift your tongue up.
We also observe the lower part of the tongue.
Open your mouth.
With the help of tongue blade, we inspect the oral mucosa for any ulcerations and we note the color of the gum. With the help of tongue depressors, we depress the tongue to get a better view of the anterior and posterior pillars, tonsils if present, and the pharynx. Using a gauge, we pull the tongue to observe the undersurface of the tongue. At first, we inspect the symmetry of the neck and note any swelling in the parotid and the submandibular gland, and also palpate for the lymph nodes. Now we feel for the pre-auricular node, posterior auricular node, occipital nodes, tonsillar, submandibular, submental, superficial cervical, and posterior cervicals. We palpate the trachea for deviation and note the space between the sternomastoid and compare it to the other side. With the help of the tangential light, we see the thyroid band.
Now sip some water. Put your hand out.
We observe the movement of cricoid cartilage as the patient sips some water. By placing our index finger near the carotid cartilage, we ask the patient to sip some water again and observe the movement of the trachea. And then we displace the trachea and examine the size and the shape of the trachea.